Hey, with my background in community and social services, not to mention my time leading urban health programs, I had to ask, what if Canada's universal healthcare was actually universal? That's why the astronaut. Get it? Universal? Anyways, here are my 20 provocative questions. Why do we accept 28.6-week median specialist wait times when Australia's universal system averages 6 to 8 weeks? What if Canada tied federal transfers to maximum wait time standards? Why does Canada spend only 6.3% of health budgets on mental health versus France's 15%? What if mental health therapy was covered like cancer treatment? Why is dental pain not treated as emergency care like broken bones when it sends 500,000 Canadians to ERs yearly? What if dental care was reclassified as medically necessary, not cosmetic? Why do provinces define medically necessary differently for psychotherapy, but not MRIs? What if Canada Health Act mandated national mental health coverage standards? Why do new immigrants face 3-month universal coverage gaps? What if rural Canadians had guaranteed telehealth matching urban standards? Why is trauma-informed care not standard in ERs when 70% of Canadians have trauma histories? What if trauma screening was mandatory at every doctor's visit like blood pressure? What if social prescribing, community programs versus pills, was funded like physiotherapy? Why isn't loneliness, smoking 15 cigarettes per day mortality risk, treated with universal prevention? What if prescription drugs were covered nationally like hospital stays? Why do 2.5 million Canadians have unmet mental health needs in a universal system? What if long-term care included mandatory mental health for dementia patients? Why are Canada's administrative costs higher than peer single-payer countries like the UK? What if universal legally meant comprehensive coverage plus maximum wait times? Why do low-income Canadians wait longer despite no user fees? Out of all of those, here are what I considered to be my top 3 most compelling questions. Question 1. What if mental health therapy was covered like cancer treatment? Assumption challenged, mental disorders are secondary or less medical than physical diseases like cancer. New possibility, full parity would dramatically reduce ER visits for mental crises, suicide rates, and chronic disease complications. Mental health drives 30% of physical health costs, creating a truly holistic universal system. Question 2. What if dental care was reclassified as medically necessary, not cosmetic? Assumption challenged, oral health is a personal responsibility luxury rather than foundational medical care. New possibility, treating cavities or abscesses as emergencies like fractures would cut ER visits for dental pain, 500,000 per year, reduce diabetes and heart disease complications from infections, and save billions in downstream costs. Question 3. What if universal legally meant comprehensive coverage plus maximum wait times? Assumption challenged, universal equals free at point of service, regardless of access or comprehensiveness. New possibility, amending the Canada Health Act to define universality by outcomes, wait times less than OECD median of 8 weeks, and coverage for mental, dental, and social needs, would force systemic improvements while preserving single-payer principles. Next, let's connect to that innovator's DNA. Dyer, Gregerson, and Christensen argue that questioning is a deliberate behavioral skill that generates the raw material for disruptive innovation. Unlike innate creativity, which produces random ideas, systematic questioning challenges unquestioned assumptions and creates space for associational thinking to generate novel solutions. This exercise demonstrated exactly that. By interrogating Canada's universal healthcare myth, I uncovered specific leverage points: mental health parity, dental reclassification, legal redefinition, that no one debating within existing parameters would see. The behavioral act of asking what if and why systematically is what separates incremental complaints from potentially transformative system redesigns, as stated by Dyer and et al. These discovery skills matter more than having a good idea, because most good ideas stay trapped within legacy assumptions. Questioning is the mechanism that breaks those traps, creating the combinatorial possibilities Dyer and et al. Describe. In healthcare policy, where sacred cows abound, this skill is particularly powerful. It reveals that true universality isn't about more money in silos, but redefining what silos even count as health. My reflection. This taught me that innovation happens at the boundary between accepted reality and deliberate challenge. I was surprised how quickly universal healthcare unraveled into concrete gaps: mental health waitlists, dental ER visits. It made me more comfortable with uncertainty. Questioning doesn't require immediate answers, just better questions that expose where the system fails its own principles.